I'm Dr. Adarsh Shukla with Midwest Anesthesia and Pain Specialists. Back pain is what I treat every day, and today we're breaking it down. Back pain is by and large the most common complaint we see. I would say 60 to 70% of the patients I see are coming in with back pain. And that I think is representative probably of most pain practices across the country because back pain is such a prevalent issue. Most people in America at some point in their lives will suffer from back pains. The good thing nowadays is that we have a lot of highly effective treatments to deal with it. So, when we think of the back, generally, we split it into three different segments, the cervical, thoracic, and lumbar. Cervical being the neck, thoracic is that mid back, and then the lumbar is your lower back. So, generally speaking, when people are coming in saying, oh, my back hurts or my low back hurts, we're usually talking about that lumbar spine, which is basically made up of the lower vertebrae or the bones of your spine, and then the discs with the corresponding nerves at each of those levels. Somebody complaining of back pain could mean anything from, hey, just my back hurts to I'm having pain in my back and my buttocks. It could be my back and my buttocks and my hip. It could be going down the leg. It could be traveling upwards. So really, there's a variety of different disease processes and things like that that can present with back pain or present as a patient complaining of back pain. Back pain, itself can come from a variety of different things, but the most common reason we see back pain is usually, a patient with some degenerative disease who's developed back pain over a period of time. Sometimes it could be what we call a radiculopathy, which is basically a term for like a pinched nerve in your back that can cause some pain in your low back as well as pain in your legs, in addition to any nerve type symptoms like, numbness, tingling, burning in the legs or the feet. And we also see traumatic back pain quite frequently. So that could be somebody who's had a fall or a car accident or another type of accident resulting in an injury to the low back. There's also muscular or what we call mechanical back pain. That could be a younger athlete who has a muscular strain or something like that, or just somebody who has some mechanical low back pain from overuse or overload or just wear and tear of the back. Oftentimes, patients will come to me when their pain is at its worst, and it's hard for them to move, it's hard for them to walk, it's hard for them to sit for any extended period of time. In those cases, we fortunately have great treatments available to us, like injections and physical therapy that can reduce the patient's pain level in the immediate term. But then the key after that is once that pain level is reduced, we have a window of time where now you have to correct the factors that led to your pain. And that's things like improper mechanics or muscular imbalances, weak core strength, things like that. And so I always tell my patients, I can reduce your pain level, but if you don't change those things, then it's more likely than not that your pain will return. And so that's where that sort of lifelong journey begins. Because if a patient can commit to a lifestyle of restoration and rehabilitation, then they can be pain free or minimal pain for the rest of their lives. So it truly is a team approach. Together, we can certainly get the patient feeling good for a long period of time. The first part will be a consultation and just getting to know the patient getting to know myself, and also a history of why you came to see me. First step of that is what's been bothering you, most likely low back pain in this case. When did it start? Did you have any environmental lifestyle factors that may have led to this, right? So what's the physical demands of your job? What about outside your job? What type of physical activities are you doing? Was there any sort of events that happened that may have led to your back pain in the past? Fall, a car accident, then getting a history of what kind of treatments have you had in the past? What have you tried that's worked, or what have you tried that hasn't worked? After getting a good sense of the history and of the patient's pain, there will be a physical exam. That's a very important aspect in determining, what the source of the patient's pain might be. It could be from the back itself, from the lumbar spine, from the bones or the discs of the spine. Is the pain coming from the nerves or the muscles, or is it maybe something not necessarily in the spine itself, but maybe it's somewhere in the hips or the glutes or the sacroiliac joints, which are in your pelvic region. So the physical exam is a very important part of trying to hone in your diagnosis and your pain generator for that patient. So once I've done that, gotten a history, gotten a thorough physical exam, I'll usually do some counseling with the patient, talk about what my impression is of where your pain is coming from, what I think the sources are, and then what I think the best treatment options are. And I'll sort of lay out the different types of treatments we have in our arsenal. And that could be, anything including physical therapy. The patient may require some imaging if they haven't had any, like an X-ray or an MRI, and then other treatments that we can offer them from there. That could be, steroid injections or nerve blocks or nerve ablations. I'll do some counseling with the patient on what those types of treatments entail. And then I'll have a general conversation with the patient about what type of recovery and recovery timeline they're looking at. I'll always try to counsel the patient and sort of set the expectation that, I'm going to do everything in my power to get you to be pain free or in minimal pain and back to your quality of life that you were able to live before you started having this pain. And then after that, the patient and myself together will make a decision on what type of treatment plan we want to proceed with. When it comes to treatments for low back pain, generally I like to break it down into categories. So from the sort of most conservative, least invasive to the most invasive. So, we start with things like medications, and that could be over the counter medications like Tylenol or anti-inflammatories like ibuprofen or Motrin, to maybe some stronger prescription anti-inflammatories, to things like muscle relaxant medications like Flexeril or tizanidine for patients who are having really spastic muscles. And those medications work really well, especially in the acute phase when the patient has just started to experience pain and it may be at its worst. And you really need to manage those symptoms quickly so that the patient can get into a rehabilitation program. That the medications play a pivotal role in that. Then moving on, you have therapy-based treatments, right? So that would be things like physical therapy. And that is probably, I think, one of the, if not the most important players in the realm of treatments for low back pain, because physical therapy is ultimately where the patient, will learn to correct a lot of the things that may have led to their back pain, or, strengthen the areas that may be weak that led to their back pain, or improve the range of motion or flexibility in the areas that are not moving properly, that is a factor in their back pain. So physical therapy is such an important treatment that we utilize for most, if not all, of our patients. I am a huge believer in it. I've personally gone through physical therapy, so I can attest to how important it is for long-term pain relief. And then moving on, for some patients who are in really severe pain, despite medication, despite physical therapy, and they still need added relief, those type of patients would respond really well to injection treatment. And so that's one of the things that myself and my colleagues, we perform. And, that would include things like epidural steroid injections, or injections into the facet joints, which are the little joints in between the bones of the spine. There's also other types of injection treatments like nerve ablations, where we use heat to actually kill the nerves that are contributing to a patient's pain. And so those treatments have a very important role to play as well in pain relief, because for the patients who, like I mentioned, maybe can't participate as effectively in therapy, or they're going through therapy and they're still having trouble with it, injection-based treatment can really help reduce their pain a very, very significant level, to allow them to then more effectively participate in a rehabilitation program. And then moving on to the more invasive, more advanced procedures, that would be things like implantable medical devices, spinal cord stimulators, peripheral nerve stimulators, and those work really well for the right patient as well. And probably some of the best studied and have the most evidence as far as chronic back pain treatments for improving a patient's quality of life, reducing reliance on prescription pain medications. So those type of advanced procedures for the correct patient are a really good option as well. And then more recently, maybe the past 5 to 10 years, there's been a real focus on restorative type treatments. And that's something that's really exciting for us in the pain management world, because a lot of what we do is symptom management or palliative. And not to discredit any of those treatments, because they all play a role, like I said, and they all can help a patient ultimately reach, minimal pain or pain-free life. But having the focus now on more restorative type treatments, where we're not just managing symptoms, we're actually trying to restore function a patient, is really exciting. So, there's a new type of treatment that's been around now for the past few years, that is a implantable stimulator, but it's called multifidus muscle stimulation. So the multifidus muscle, which is one of the key postural muscles runs along our entire spine, is a big culprit in chronic low back pain. And often what we see on MRIs of patients who have chronic low back pain is that that muscle becomes infiltrated with fat. So it actually loses the muscle tissue, it atrophies, and then it gets replaced with fat. And so that makes the muscle less effective in maintaining proper posture and proper mechanics. And that multifidus muscle specifically is not one that's easily controlled consciously. So, for example, lots of people try to exercise weak muscles to fix painful areas. So, you can exercise certain muscles. You can exercise the superficial back muscles. You can exercise your core muscles to try to improve your back pain. But certain muscles are under what's called autonomous control, and the multifidus is one of those. So, what that means is that the multifidus is activated without us even consciously knowing about it. So, when you go to stand up or when you go to start walking, that muscle immediately activates without us thinking about it to help maintain our posture. And so, if that muscle is weak, then you can imagine that the proper mechanics, the proper posture, and things like that will not be maintained during those activities. So, by being able to stimulate that muscle with an implantable stimulator, we can actually restore the function of that muscle. And so that's what I mean by restorative treatments. And that's something that's pretty exciting. Address it sooner rather than later. We know that with back pain, the longer you wait to address it, and if you continue to experience pain, the more likely it is that that pain is to become chronic and long lasting. To anybody experiencing back pain, I always say get it addressed, get it checked out by a healthcare professional sooner rather than later. Yes, we accept Medicare, and pretty much all of the treatments that we offer are covered by Medicare, with the exception of maybe a small number of treatments. So some of the newer regenerative therapies, things like PRP or platelet-rich plasma, which are still kind of being studied and don't have as robust evidence, those type of treatments are not covered by Medicare just yet. Otherwise, I would say a majority of our treatments are covered by Medicare. Anybody living with back pain, anybody suffering with back pain, don't feel like you have to sit at home and suffer and your back pain is just going to be there and you have to tough it out. That's, I think, one of the most common misconceptions I see in back pain in the general population is people thinking, I have this back pain and it's going to be with me for life and I just have to tough it out or adjust my lifestyle or adjust my activities and not do things I enjoy. We are very often able to get our patients back to living active lifestyles, doing things that they enjoyed doing prior to having back pain, physical activities, sports, gardening, walking. So there is a lot of treatment options available and there is hope. So I would highly suggest anybody suffering from back pain, seek out your doctor.